Is your teenager struggling to keep up with schoolwork, showing impulsive behavior, or constantly restless? These could be more than just typical teenage challenges. They might be signs of ADHD. In today's video, we'll explore what ADHD looks like in teenagers, the challenges they face, and how to help them manage symptoms effectively so they can thrive during these critical years. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects a teenager's ability to focus, control impulses, and stay organized. Unlike what many people think, ADHD isn't just about being hyperactive or easily distracted. It affects executive functions in the brain, meaning it impacts how teenagers manage time, organize tasks, and handle emotions. ADHD is not something that develops suddenly in the teenage years, it's present from birth. The exact causes are still unknown, but it involves imbalances in neurotransmitters, which are chemicals that help brain cells communicate. These imbalances can make it hard for the brain to know when to focus or relax, leading to the symptoms we see. ADHD comes in three main types: inattentive, hyperactive impulsive, and combined. Teens with the inattentive type often struggle with time management, forgetfulness, and organizing tasks. They might lose track of conversations, overlook details in their work, and avoid tasks that require sustained mental effort. It's not that they don't care, they simply find it difficult to focus. Teenagers with the hyperactive impulsive type might always seem on the go. They may talk excessively, fidget constantly, or struggle to stay seated. They might also act without thinking, interrupt others, or take unnecessary risks. Combined type is a mix of both inattentive and hyperactive impulsive symptoms. These teenagers face challenges in multiple areas and often show more severe symptoms. To be diagnosed with ADHD, these behaviors must impact a teenager's life in more than one setting, like at home, school, or in social interactions, for at least 6 months. It's important to remember that ADHD symptoms can sometimes be mistaken for other mental health issues, so getting a proper diagnosis from a specialist is crucial. ADHD can make the already tough teenage years even more challenging. Here are some common struggles. Substance use. Teens with ADHD are at a high risk of experimenting with drugs, alcohol, or smoking. They might use these substances as a way to cope with their symptoms or to feel more normal. This is why it's crucial to provide them with healthy coping strategies early on. Risky behaviors. The impulsivity associated with ADHD can lead teens to take more risks. This includes dangerous driving, unprotected sex, and other high-risk activities. These behaviors not only pose immediate dangers but can also lead to long-term consequences. Social challenges. Teens with ADHD often find it hard to form and maintain friendships. They might feel misunderstood or rejected by peers, leading to feelings of loneliness or frustration. Social difficulties can lower their self-esteem and make it harder for them to feel accepted. Sleep problems. Many teenagers with ADHD have trouble sleeping. Anxiety, hyperactivity, and overstimulation can make it difficult for them to wind down, leading to irregular sleep patterns. Poor sleep can worsen ADHD symptoms, creating a cycle that's hard to break. Managing ADHD in teenagers typically involves a combination of medication, therapy, and lifestyle changes. Medications like stimulants and non-stimulants can help improve focus and control impulsive behaviors. Therapy, especially cognitive behavioral therapy, CBT, teaches practical skills to manage ADHD symptoms, such as time management and emotional regulation. It's also crucial for parents to be educated on ADHD to provide the right support at home, which includes setting consistent rules and helping with organization. Schools can offer academic accommodations to support learning, while regular physical activity and mindfulness practices can help reduce symptoms. These combined approaches aim to empower teenagers with ADHD to thrive despite their challenges. ADHD doesn't have to define a teenager's life. With the right support, strategies, and understanding, teens with ADHD can lead fulfilling and successful lives. It's all about learning how to work with the unique way their brain functions. By embracing these strategies, teenagers with ADHD can navigate their challenges and unlock their full potential. Remember, ADHD is just a different way of thinking, and with the right approach, it can lead to incredible creativity and success.